All right, long awaited EMDR. I am over the moon to be able to say that we now at Ethredge Counseling Group offer EMDR. All three of our clinicians are trained and ready to go. So, what in the world is EMDR? EMDR stands for eye movement, desensitization, and reprocessing. And that is a really great description of what it is. So it has a lot of similarities to, if you've worked with me before, it has a lot of similarities to how we work anyway. But it's pairing talk therapy with eye movement. And so this eye movement, I'll go ahead and clarify, this is not hypnosis. You may have seen some clips of EMDR and you'll see the therapist kind of doing their fingers like back and forth like this, or maybe their hand back and forth like this. You're not being hypnotized. It is actually mimicking what your brain and your eyes already do. So many of you have heard of REM sleep, right? This REM cycle of sleep that's really crucial for us. Sleep is crucial anyway, but this REM part of our sleep helps us process memories and store them. So the eye movement of EMDR actually mimics what our brain and body already know to do to process our life experiences, but it's doing it in the safety of your therapy room with your therapist. And it's really giving your brain a chance to go back and reprocess memories that it may not have been able to process in the moment. For the human brain, our brain isn't able to process traumatic memories in the way it would process like something that's not traumatic at all, like going to the grocery store, right? You can remember that you went to the grocery store last week, right? Or maybe you don't even remember. It feels like really foggy and far away. That's because it wasn't traumatic. Your brain was able to put it in the filing cabinet in the right file and close it shut. And because it's all done, it's all complete, processed, and done. Whereas a traumatic memory may be fragmented, or we may experience things in our day-to-day life that trigger us to feel the old feelings, the old thoughts, the old beliefs, the old images in our present moment. And so EMDR gives your brain a chance to process that memory in a safe, calm, resourced way. And resourced means you feel safe and grounded. Your body, brain, nervous system is feeling secure, has enough resources in the moment to feel calm and secure and grounded. So in a resourced way. What else to describe? Okay, so EMDR it's not a cure-all. It's not a magic, there are no magic pills, but it can be a very highly effective treatment for quite a number of things. I mean, basically anything you throw at it, it could potentially be really helpful for it. So some of the things on the list that I've seen, maybe I haven't worked with all of these, but insomnia, chronic pain, panic attacks, definitely, trauma, definitely, any type of trauma, small or large, things that would cause, so you've heard of attachment styles, so things that would cause insecure attachment, it can work with those things. Headaches, did I already say insomnia? Anxiety, depression, OCD, I mean, the list goes on. It's really quite remarkable. It fits in really well with your normal therapy. So it's not something that you have to do continuously. And it's not something also that you would just go in for a few sessions and be done with therapy altogether. It really works well in the context of your already established therapeutic relationship with your therapist. So you can continue you may be seeing your therapist for a while, want to try EMDR if they're trained in it, and then continue therapy as normal to be able to have a safe place where you can talk through relationship dynamics and all of these things. So it's a shorter term treatment. A really cool thing about EMDR is that the brain does something called generalization with it. So it's not something that you would need to use with every single negative experience you've ever had in your life for it to work. In fact, some clients have had the experience of doing maybe 1 or 2 events, and the brain generalizes into these other negative experiences so that you don't have to go through each one and process it. They kind of get resolved on their own. And that's another cool thing about therapy in general and EMDR specifically, that your brain continues to work and process between sessions. So a lot of the work, and this is true of therapy anyway, what makes therapy work isn't always what's happening in the therapy room. It's happening what's happening between sessions, right? Like if you're not thinking about these things, using these skills between sessions, not that therapy won't be helpful, of course, but a lot of what is happening in the brain when you're not in the office at all. All right, what else? EMDR. What have I left? Oh, the phases. Okay, so there are 8 phases to EMDR, and I'm going to put them in out of order or something, I'm sure. We have history taking, so kind of what's bringing you in. Let's explore and list a lot of the memories that are connected with those things. So you're taking a full history, and treatment planning. That's number 1. Then you're going to number 2 is preparation. So that's things like building skills, coping skills, doing some guided imagery. You're kind of preparing, getting ready, getting all the structure in place. I'm already forgetting. What's number 3? Did I just say 3? Something comes next. Then desensitization, installation, which is basically just establishing an alternate belief. So EMDR is working on beliefs, memories, triggers, images, emotions, body sensations. So it's working on a bunch of different areas. So during the installation piece, you're working on establishing new beliefs about yourself. So let's say, your parents got a divorce when you were young, and that was maybe a traumatic experience for you, to having them separated, and maybe you really questioned as a kid. It's very typical for kids to blame themselves when something negative happens, of course. And so maybe subconsciously you've been carrying around this sense that when bad things happen, I must have been at fault in some way, right? And this is maybe a subconscious belief that you're not even really aware of, or maybe you are. You kind of know, I tend to blame myself when things go wrong. Even if it's outside of my control, right? So EMDR is addressing some of those core beliefs about ourselves too. And so during the installation period, we are kind of we're installing it, right? EMDR was developed in the 80s, so there's sort of that language around, installation, of course, is the word that would be chosen in the 80s. Instilling a new belief about ourselves. So maybe when bad things happen, I still have agency, or when bad things happen, that doesn't mean that I am bad. Something along those lines, right? Then we have the closure, so kind of wrapping it all up. And then that doesn't mean it's over, because we were going to do closure on every memory that gets processed in a sense. So there's a lot of jumping around. In EMDR, you're not like once you get to the 8th phase, you're done. There's a lot of kind of jumping around during all of this. I really kind of don't like that it's called phases, because it makes it sound that way. And then the last one is the reevaluation. And that's where you're kind of seeing, okay, do we need to go back up to the original memory and do some processing there? Or was there sort of a new memory that came up during all of this, and we're going to go to that one? So you're just sort of reevaluating, see where you are on the game plan, on the treatment plan, and kind of going from there. EMDR sessions usually are a little bit longer. You can absolutely do it in a regular session time, like 50, 60 minutes. Ideally, you're going to do it in a 90-minute session, and you want to do it back-to-back sessions in a week, weekly set. You want to schedule them weekly, and that is because if some stuff gets stirred up, you don't want to wait 2 weeks till your next appointment, right? So we want to go ahead and schedule them weekly so that it's there if you need it, right? And we can go ahead and get these things taken care of versus like dragging it out. Now, EMDR actually can be done as in an intensive setting. So it is possible to do maybe a 90-minute session, 3 days in a row, that type of thing. Absolutely not required, but that can be, some therapists will do that as well. Yeah, so if that sounds like something, well, I'll do a little demonstration. So just so you kind of have an idea of what an EMDR session might look like around when you get to the eye movement. And some clinicians don't do eye movement. There are other ways to do what's called bilateral stimulation, which is what the eye movement is. You're bilaterally stimulating the right and left hemispheres of the brain. Some situations you may do some tapping, so alternating tapping your shoulders or your arms. There's also something called tappers, which are just these little pieces of little paddles, tiny little paddles you hold in your hand connected with a cord, and they vibrate like a very gentle, it's not like no, we're not shocking anybody, just a little gentle vibration. So you're just it's just bringing your brain's attention to right, left, left. You can also do headphones, maybe with beeps, beep, 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 alternating sides, or music that's alternating sides, anything that can go. Now, the most effective one is the hand. And so I'll give a little demonstration. So you're going to sit sort of catty corner to your therapist so that you're not directly looking at your therapist, you're looking at her hand. I like to do my open palm, it's just more comfortable for me, but some clinicians will do 2 fingers. That just sort of puts a weird strain on my tendon, so it doesn't feel good for me, and I can do this much more comfortably. So I would just say, I'd have you focus on a memory or an image or an emotion. So I might say, you're thinking of, the day your parents split up. I don't know. And so I would just say, go with that. That's sort of the catchphrase of EMDR. Go with that, and you're just going to let your brain. There's really nothing much for you to do, honestly. For a client in EMDR, you don't really have a job to do. You're just letting your brain. Your job is just to notice, and that's it. Your job is to notice. So you're just going to notice. You're thinking of that image, and you're just going to notice what happens. And you might notice a body as you're looking at my hand. And I'll do that for 30 seconds, and then I'll stop, and I'll say, "What do you notice?" And you'll just tell me what you notice. You might say, "I'm still thinking about that. I'm still picturing, looking out the window." Great, go with that. And then 30 seconds, pause. Okay, what do you notice now? You might say, "Oh, I feel this anger come up." And I'll say, "Great, go with that. Go with that." And then you might say, "Now I'm feeling this like weird headache coming on." Great, go with that. So it is like you are I've heard this metaphor and I loved it. It is like you are on a train, okay? And so we're going down the tracks for 30 seconds at a time. And every 30 seconds we pause and I ask you to look out the window. And you just tell me what you see out the window. We're not judging it. There's no right or wrong answer. It's just what is there, right? And your brain pairs things sometimes in an odd way that's not going to make sense to me. It's not going to make sense to you. It doesn't need to make any sense. Our brain has those neural networks. It's going to pair things in our memory together. That isn't, we don't judge it. That is not part of EMDR. It doesn't really matter what comes up. The most important thing is just for you to notice what comes up and for you to let me know what it is so that we can continue on. That's all it is. So you might notice a body sensation, like, wow, my knee started hurting. Or I feel a little nauseous. Doesn't matter. You might feel any type of emotion. You might have a thought. Remember, thoughts and emotions are 2 separate things. You might have a thought. I remember this thing, or I'm feeling this belief about myself that I am unworthy, or whatever it might be. So a memory might pop up. All different things. So it doesn't really matter what it is. We just go with it. And we're basically slowing down the process so our brain can do what it didn't get to do before. And our brains are, there are no bad brains. Brains are amazing. They know what to do. And it's gonna do what it needs to do and what it didn't get to do originally the first time we experienced that thing. So if EMDR sounds like something that you want to try, we would be thrilled to get you on the schedule. Now, we can offer EMDR virtually or in person. If you are in the Charleston or James Island area, we do ask that you come in person. But if you are outside of our immediate vicinity, so if you're up in like Rock Hill or Columbia or can't drive, or if you are in Tennessee, and later in the year, if you're in Arkansas, we'll also be able to do EMDR for you in those states as well. So, and also if you're interested in therapy, but you don't think EMDR is for you, that's absolutely fine as well. It's one tool in the toolbox, and there are many other effective tools. Simply having a place that feels safe where you can talk about something is also effective therapy. You don't need to do anything separate than that if it doesn't interest you. 100% absolutely. So there's a little bit more information about EMDR. Schedule a free consultation if you're interested in therapy with us, and leave a comment if you have any questions, and I'll try to answer those. Thanks. Have a great day.